Welcome everyone, and thank you to those joining us live and to those listening in afterwards. I would also like to warmly welcome our guest today, whom I will shortly introduce. Our webinar today is titled Transforming Pharmacy Practice for Improved Care and Management of Mental Health. The importance of good mental health and well-being has gained attention over the last decade due to an increased burden of disability and loss of quality of life associated with mental health conditions. Pharmacists have a significant role in the support and management of persons with mental health illness and in reducing the commonly associated stigma. FIP has developed a new handbook to support pharmacists and their organizations in providing a range of mental health-related services. In addition, the handbook will be accompanied by the Knowledge and Skills Reference Guide in Mental Health, which identifies the Q&As that pharmacists required for the provision of such services, thus offering guidance to pharmacists, academic institutions, and CPD providers. Both publications will be launched at this event, and they are part of the FIP Practice Transformation Programme on Non-Communicable Diseases. Our speakers will explore this in further detail in this webinar. Next, please. But first, to introduce myself, my name is Inês Nunes da Cunha, and I am the FIP Practice Development and Transformation Projects Manager. It is an honor and a privilege to be moderating this event. For this event, we are joined by a panel of fabulous speakers, and I want to sincerely thank each of them for taking the time to prepare their presentations. We have first Clary O'Reilly, Senior Lecturer from the University of Sydney School of Pharmacy, Australia, and also Sarira L. Den, Senior Lecturer from the University of Sydney School of Pharmacy, Australia. We have Jeff Dong, FIP intern and PharmD candidate from the University of North Carolina, Wellsman School of Pharmacy, United States. And finally, we have Delia Badges, FIP lead for provision and partnerships. As you can see in the next slide, we have some announcements, and please note this event will be recorded, live streamed on FIP YouTube, and the recording will be available at events.fip.org. To all those listening, please feel free to send your questions through the Q&A box provided, and I will do my best to manage all the questions so that at the end we'll be able to address those questions. You are welcome to provide feedback to webinars@fip.org. And I would like to take this opportunity to promote the benefits of membership with FIP, including events and webinars. FIP is the global body representing over 4 million pharmacists and pharmaceutical scientists. If you are a pharmacist or pharmaceutical scientist and you would like to become a member, please register on FIP website at fip.org. For our program today, firstly, I will introduce the FIP Practice Transformation Programme on Non-Communicable Diseases, NCDs. Next, Claire O'Reilly and Sarira L. Den will co-present the pharmacist's roles in mental health care. Jeff Dong will launch the Mental Health Care Handbook for Pharmacists, and Dalia Badges will launch the Knowledge and Skills Reference Guide for Professional Development in Mental Health Care, a companion to the FIP Mental Health Care Handbook for Pharmacists. And lastly, you will have the opportunity to ask questions, and our panelists will make some closing remarks. There are a number of learning objectives for this webinar, and we hope at the end, attendees will be learned about the role of the pharmacists in the prevention, identification, care, and management of mental health illnesses, the challenge and the opportunities for pharmacists in addressing mental health illnesses, and the knowledge and skills pharmacists need to acquire to support their role in mental health. Next, please. FIP is working in the FIP Practice Transformation Programme on non-communicable diseases that aims to provide tools and strategic support to FIP members organizations to develop and implement pharmacy service that can have a sustained positive impact in the prevention, screening, management, and treatment optimization of NCDs for improved health outcomes and health systems efficiency and sustainability. While this project will have a particular focus on low and middle income countries, it will encourage implementation by countries of all income levels. Next, please. One more, please. The program includes the development of practice support handbooks, knowledge and skills guides, implementation guidelines and support and training for competence development in each of the 5 main NCDs that you can see in the slide. Diabetes that we launched last year, mental health that we'll launch in during this webinar, chronic respiratory diseases, which will be launched at the end of September, and cancer and cardiovascular diseases that both will be launched in October. Next, please. The vision of the program is to promote the global transformation of pharmacy practice and the quality improvement of services delivered to improve health outcomes and the quality of life of individuals living with non-communicable diseases. And the aim mission is to assist FIP member organizations in assessing their country's needs for pharmacy services that address the burden of NCDs, to provide guidance for education and training support to pharmacists, transforming the way they provided NCDs related pharmacy services, to support FIP member organizations and individual members in the implementation of pharmacy service and programs that can reduce the burden of NCDs. As you can see in the next slides, the FIP Practice Transformation Programme is alignment with many FIP development goals, special with advancing integrated services, medicines, expertise, and also people-centered care. Next, please. Non-communicable diseases are indeed a top priority area for FIP. This is reflected in the FIP Development Goal 15, focusing on people-centered care, which is entirely devoted to this important group of conditions. Today, we will focus on FIP Practice Transformation Program on mental health. It is a knowledge that there are a number of opportunities for pharmacists to engage in mental health care and provide services to their patients, ranging from prevention to screening to management and much more. With the proper knowledge and skills, pharmacists will be well positioned to address the global burden of mental health and promote mental health and well-being in their communities. Like I said before, today we are proud to launch the Mental Health Care Handbook for Pharmacists that you can see in the left. This handbook aims to identify and describe the key evidence-based interventions by pharmacists in this area, with the dual aim of supporting their implementation in pharmacy practice and supporting advocacy efforts by FIP member organizations towards the optimization and expansion of pharmacy scope of practice in mental health and NCDs in general. We are also proud to launch the Knowledge and Skills Reference Guides for Professional Development in Mental Health Care, a companion to the FIP Mental Health Care Handbook for Pharmacists, which acts as a companion to the handbook to further guide mental health care for pharmacy professionals on a global scale through enhancing the handbook with the required knowledge and skills necessary to support community pharmacists. Next 2 slides. I already said the aims of the 2 publications, and Delia and Jeff will go into the aims in their presentations. And we now go move to the first presentation, I will introduce our first speakers. We'll provide a co-presentation on pharmacists' roles in mental health care. Today, we have the pleasure to receive Dr. Sarira. Next, please. Dr. Sarira L. Ben is a pharmacist, senior lecturer and master mental health first aid instructor at the University of Sydney School of Pharmacy. Sarira's current work focuses on depression screening, perinatal mental illness, pharmacists lead care for people living with severe and persistent mental illness, as well as co-designing education by working with mental health consumers and professionals. Sarira is the National Education Representative of the Australasian Pharmaceutical Science Association and a Fellow of the UK Higher Education Academy. In 2022, Sarira was awarded the Early Career Pharmacist of the Year award by the Pharmaceutical Society of Australia, NSW. I also have the pleasure to present Dr. Claire O'Reilly, that is a senior lecturer at Sydney Pharmacy School, pharmacist and mental health first aid instructor. Dr. O'Reilly is considered a national leader in the area of pharmacists' roles in mental health care and has led various research projects, policy initiatives, and established evidence-based training programs to enable pharmacists to have an enhanced role in support and care of people living with mental illness in Australia. Currently, she is co-leading a large partnership program grant focused on the physical health of consumers living with severe and persistent mental illness in primary care settings. In addition, she is also leading a trial of community pharmacists-led collaborative screening and referral for older adults at risk of depression. Dr. O'Reilly has held numerous leaderships in roles in the profession, including a national vice president of the Pharmaceutical Society of Australia, and as the first pharmacist to be appointed to the Medical Services Advisory Committee, which provides advice to government on the strength of evidence and cost effectiveness of medical technology and procedures. Great to have you both as the speakers today. I will hand over to you. Thank you very much.
Hello, everyone. It's a pleasure to be here. Thank you, Inez, and thank you, FIP, for having us. I'll be starting Claire and my presentation by talking briefly about mental health burden and setting the scene, giving you all a global perspective about this important issue. Mental illness is estimated to affect approximately 1 billion people worldwide who are living with a mental illness. Due to the impact of the pandemic, some recent estimates show us that there have been increases in the prevalence of mental illnesses, including depression and anxiety. In most countries and globally, anxiety and depressive disorders are the most common mental illnesses, but there's a broad range of illnesses that fall under the umbrella term of mental illnesses. And these include substance use disorders, bipolar disorders, schizophrenia, eating disorders, among others. And it's important to remember that sometimes people experience multiple mental illnesses at one time, or comorbid mental illnesses. Mental illnesses collectively are among the leading causes of burden globally and are in the top 10 causes of burden. An important issue in the context of mental illness is suicide, which is the cause of death for over 700,000 people every year. And it is a leading cause of death among young people. We have some evidence that shows us that it is, in fact, the fourth leading cause of death among people aged 15 to 19. The majority of suicide deaths occur in low and middle income countries, but that's not to say that it's not a important issue and among the leading causes of death in some populations within high income countries as well. And some of the common methods of suicide deaths include pesticide ingestion, hanging, and firearms. And means restriction is an important avenue for suicide prevention, which we'll touch on a little bit later. This slide here is just shows us some data from 2016 to 2019 in the two images. And the reason I wanted to share this is to show that among people aged 15 to 29 globally, over 3 years, despite suicide prevention efforts, we can see here from this data that suicide remained a leading cause of death in both men and women globally in the age bracket of 15 to 29 years between 2016 and 2019. One thing that I think is important for us to consider is how we, as a health workforce, contribute to suicide prevention and mental health treatment and recovery. And something that acts as a barrier to that is the low number of mental health workers in lower middle, upper middle, and even globally, the low number of mental health workers. The reason I'm showing this slide here is I think this graph really shows us the vast disparity in the number of mental health workers if we compare low and high income countries. But even on a global level, we need a much larger mental health workforce to deal with the growing issue of mental illness. I'll now pass on to my colleague, Dr. Clara Riley, and I'll be back in a little while.
Thank you, Sarira. It is also my pleasure to join you on this webinar this evening from Australia to talk now a bit more about the roles for primary healthcare professionals, including pharmacists, as part of mental health care. So we do know that people do often try to seek help in the lead up to a suicide attempt or to a death by suicide. And some of the evidence shows us that close to half of people have contacted a healthcare professional in the month prior to a death by suicide. And when we look at that more closely, we see that most commonly that's actually a primary care physician, so a general practitioner in the 3 months prior to suicide deaths, or in a presentation to the emergency departments, around 40%. But what we generally see is that primary healthcare services are accessed over 2.5 more times than specialist mental health care services are in the lead up to a suicide death, highlighting that primary healthcare role, which does include pharmacists. However, we do know that there can be negative and stigmatizing attitudes from healthcare professionals towards mental illness, which we'll touch on more as part of this presentation. And we know that they can lead to detrimental outcomes. It can delay, it can prevent people from seeking help and from recovering. So it is an important issue we need to address. And we also know from our own work that a recent systematic review we did highlighted that the majority of healthcare professionals, not just pharmacists, but primary healthcare professionals and more broadly healthcare professionals, really do receive insufficient training around suicide prevention as part of their university training. So when we look at approaches to suicide prevention, if we look at the WHO approach here, we see that there are a number of evidence-based interventions. We do know that suicide prevention needs to be multifaceted, but there are evidence-based interventions that we do know can work. And some key ones here are around limiting access to means for suicide, which can include certain medications, which highlights that important role for pharmacists in limiting access if we know somebody is at risk. It's also important that we report responsibly about suicide, and the media have a role to play there, that we support young people. When we look at those statistics that Sarira brought up there earlier, we know that this does affect young people in very high numbers. And really there's a focus on early identification, being able to assess, manage and follow up anyone who might be displaying signs of suicidal thoughts or behaviours, which really highlights the opportunity for pharmacists. And it's really pleasing to see that in recent years, we've seen a number of organisations that have started to recognise the pharmacist's role. In Australia, I was involved with the Pharmaceutical Society quite a few years ago now, back in 2013, to really look at a framework for pharmacist contributions as part of the mental health care team. FIP previously had done completed a document called Focus on Mental Health, and also the Royal Pharmaceutical Society in the UK have a really important document about no health without mental health. So it's really pleasing to see on top of these previous documents that we're here to launch a new FIP important handbook and guide today. So now we're just going to move on to have a look at some of the evidence base around the world around evaluating pharmacist roles within mental health care. And when we talk about pharmacist roles in mental health care, these can be really broad. And this is just a bit of a snapshot here to give you some ideas of different ways that pharmacists can contribute as part of mental health care. It could be through really brief clinical interventions, supporting adherence as a key aspect, medication reviews in various forms that they may take in various countries are very important for people who often have polypharmacy and multiple comorbidities as well. They may be taking complex medications such as clozapine, and pharmacists play an important role in supporting that. We just mentioned that limiting access to means of medication is an important aspect too. So stage supply services might play a role there, but also recognising that people with a mental illness often have poorer life expectancy, and that's often due to poor physical health. And there's a number of ways that pharmacists can help contribute to their physical health care as well. So just focusing on the early intervention aspect, pharmacists can certainly play a really important role in trying to intervene early when they recognise there might be some early signs or symptoms of mental illness. And as we can see here, two of these kind of documents here are from the US, which have highlighted kind of the important role that pharmacists can have in depression screening, and that can save lives. And on the bottom right-hand side there, we can see an example from Australia around highlighting that while there has been some research that's demonstrated effectiveness of pharmacy screening more broadly in a number of disease states, we really do need more evidence base in the mental health field. And this is an area that we are working in quite a bit in Australia. We know that in Australia, the statistics show that 2/3 of people are not seeking any professional help for their mental health symptoms. Yet we know that pharmacists are accessible, they're trusted. So we have an important role in recognising early warning signs, engaging people in a conversation and triaging them and referring them on to appropriate healthcare services. And this is an area we've been working on for a while, and particularly in certain population groups, we think this is particularly important, such as perinatal women or older adults who often have chronic illnesses or are taking multiple medications. Another really important area that we've mentioned is the pharmacist's role in suicide prevention. And there's been a number of reviews here. You can see 3 reviews here in recent years that have been looking at what the evidence base is and what that role may be for pharmacists in terms of suicide prevention. And on the top right-hand side there, we can see a study from some of our colleagues in the UK, which really is added to that by having some perspectives of community pharmacy team members around their perspectives on their role in suicide prevention. And I think it's important to look at how common this is. So in some work we've done with our colleagues in Canada, we've looked at pharmacists' experiences around providing suicide care. And our study found that over 85% of pharmacists had interacted with someone at risk of suicide at least once while in their workplace. And 16% of pharmacists had actually interacted with someone at risk of suicide at least 6 times. And when we asked pharmacists about their most prominent experience, we found that less than half of them carried out an appropriate suicide assessment. Only 13% of them directly inquired around suicidal thoughts, when we know that's actually what training advises us we should do. 60% felt they're uncomfortable about their involvement in that scenario, and often they came out, being dissatisfied with how they handled the situation. And really, the key barriers that pharmacists recognised were training and access to resources as some key barriers to support them in that role. And what we found between the countries was that more Australian than Canadian pharmacists had prior training, but we haven't really seen the follow-on impact of that. Needs further research on that one. And if we also look at some further data on this from the United States, there's a study in the United States which highlighted some similar findings. They found that about 22% of pharmacists knew a patient who actually died by suicide, and about 1 in 5 pharmacists knew a patient who had requested a lethal medication dose from them. And about a quarter of them were uncomfortable talking with at-risk patients about this, and similarly identified similar barriers around fear of worsening the situation so that they might say the wrong thing, which really highlights a lack of training and confidence around asking those appropriate questions, and lack of knowledge and lack of time in the pharmacy setting. So now if we look at a couple of different large mental health projects from different places in recent years, there was the Australian Mental Health Project that was conducted a few years ago by colleagues of ours at Griffith University. This was a pharmacist-led, goal-orientated medicine support service which focused on consumers with depression and anxiety. And this study identified that by having that flexible, goal-oriented service with a community pharmacist, that it led to improvements in adherence, motivation and confidence to deal with their mental health problems and medications. And it was found to be a feasible service that pharmacists could provide. And then if we move to Canada, some colleagues of ours in Canada have run a very successful Bloom program of a number of years, which is a pharmacy-based mental health and addictions program based in Nova Scotia. So this is about aiming to support recovery and address health and medication issues over a 6-month period. And they conducted a pilot study which was aiming to evaluate the impact of this pharmacy-led support for people with mental health and addictions care. And what they found as part of their this pilot study was that the Bloom program led to more collaboration with broader healthcare team members, and that collaboration as part of the team was critical to the success of the program. They also found resolution or improvement to the majority of medication issues that were identified by pharmacists. It improved access to care and increased options for help seeking, especially amongst those who had poor access to other healthcare in rural areas. And they were successful in gaining ongoing remuneration through the province to continue to fund this service, which is fantastic to see. And just further on the Bloom program in terms of what types of activities they were doing, I think it's really interesting to note that only 40% of the activities that Bloom program pharmacists were identifying or taking part in was relating to medication management. So they were really commonly involved in a range of other activities such as education, triage, navigating to support people to access services in their local area, self-care and social support. And really, just that key point I want to mention, that it was really key that they had collaboration with the broader healthcare team to make this a successful program. And back to Australia, just like to mention a study that Suru and I are both involved in with colleagues at Griffith University, which is called the PharmaBridge randomised controlled trial, which is about bridging the gap between physical and mental illness in community pharmacy. So this builds on that earlier study in Australia, which looks at an intervention which is pharmacist-led. It's a support service for people that live with a severe or persistent mental illness, compared to a standard of care, which is a meds check or a medicines use review in pharmacy service. And we're looking at our key outcomes are around medication adherence, particularly for psychotropic medicines, but also there are other prescribed medications, as well as looking at other broader outcomes around quality of life, physical health and psychological wellbeing. We're also hopefully looking at how the training and the program more broadly is helping pharmacists to improve their confidence, knowledge and ability to work with people who live with severe and persistent mental illness, and hopefully identifying a service that's acceptable and cost effective to the Australian government, so that hopefully in future we can continue to have a service like this funded. And now I'm just going to pass back over to my colleague Sarura to talk about mental health education needs. Thanks, Sarura.
Thank you, Claire. So to wrap up our section, our presentation, the last kind of topic I'll talk about is around mental health education. A term that we've spoken quite a bit about today and is very important in the mental health education and research field is stigma. And I think it's important that we take a moment to define stigma, which has been defined as a mark or sign of disgrace, usually eliciting negative attitudes to its bearer, and from a conceptual point of view can be seen as an overarching term including difficulties associated with knowledge, attitudes, and behavior. And stigma can lead to various negative consequences, including delays to help seeking in the context of mental illness. It leads to label avoidance as well, where that is defined as when a group of people are avoided altogether so that a person is not marked with the label. And in this context, that label would be around mental illness. Stigma can also lead to discrimination, which is the behavioral result of prejudice. And discrimination can appear as both actual discrimination, where, you know, as an example, a person is unreasonably rejected from being successful in a job because of their illness in this situation, or even anticipated discrimination, where a person doesn't even apply for the job in the first place because they feel that there's no way that they're going to be successful. An important thing to consider when we're thinking about stigma is our language. And in recent years, there's been quite a bit of change in the way we know how to speak about suicide, for example. And if we think about earlier when Claire discussed some approaches to suicide prevention around responsible reporting and responsible communication in the media, our language is really, really important in that kind of context. So as an example, we don't want to be using terminology that is negative or that is associated with crime or violence when referring to mental illness. So for example, we don't want to say things like committed suicide, but rather we want to say completed suicide or died by suicide, because the term committed is often affiliated with a criminal activity, in that people often commit crimes. And that's kind of where our mind goes when we hear that word commit as an example. So language is really, really important as a strategy to reduce stigma, and we need to all be conscious of the language that we're using in this context. There's been some research, including research from our team at Sydney Uni in Australia, that has looked into stigma and stigma in healthcare settings. Healthcare professionals are not immune to exhibiting stigma. And this study that is shown on the slide here, it showed us that the majority of people living with severe and persistent mental illness had experienced stigma in at least one aspect of their life. For a large majority of them, that was by family members and friends, but they also anticipated a lot of discrimination, and that led them to conceal or hide their mental illness. So they didn't feel comfortable being honest about saying that they were living with a mental illness due to that anticipated discrimination and stigma. And we see here in one of the quotes at the bottom that one of the participants mentioned about how even a doctor, they felt that a doctor was being stigmatizing to them. So all of us as healthcare professionals have a role to play in reducing stigma. And speaking of reducing stigma, there have been some strategies that have been shown to be effective in terms of stigma reduction. And these include education, which allows us to challenge inaccurate stereotypes and replace myths with facts. Contact, whereby people will have contact with those living with mental illness, and this can be really powerful in challenging previously held beliefs. And contact has been found to be the most effective strategy in reducing stigma. And thirdly, protest, where publicly challenges to negative portrayals and stereotypes are made, like condoning something that is said inaccurately in the media or on the news and things like that. So we've done a bit of work around looking at how we can improve or reduce stigma by increasing contact with people with lived experience of mental illness. And we've done quite a few studies in this area. And this slide really just summarizes some of the key findings that among students who have participated in these studies, in general, they've had a reduction in stigma from this contact in educational settings. It's allowed them to have greater insight into mental illness, and they really value opportunities to have a chat and practice their communication skills in a safe learning environment with people with lived experience. And we've also done a bit of evaluation with the mental health consumers themselves, who also have found the opportunity to contribute to the education of future healthcare professionals to be really beneficial and quite empowering. And we're hoping to continue to do work in this area. Another important, I guess, training related thing to mention in this context is mental health first aid, which I think more and more of us are starting to hear about mental health first aid, maybe even attend a mental health first aid training program. Claire and I are both mental health first aid instructors. And even though mental health first aid did start in Australia about 22 years ago, it's now spread to many countries around the world. And on this slide, you can see the logos of some of the countries that have mental health first aid, but there's about 20 or 25 globally that do. And, you know, there's mental health first aid in England, for example, in Australia, in America, and in other countries. So it might be available to you in your country as well. And that's something to look into. Is mental health first aid effective? There's been quite a few studies and more recently reviews asking that exact question: is it effective? And in summary, I guess the short answer is yes, it is effective in improving self-reported knowledge, attitudes, confidence, and behaviors, and it does lead to improvements in terms of stigma reduction. We've also seen, due to this effectiveness, mental health first aid training being increasingly embedded or offered through university curricula for healthcare students, whether it's pharmacy students or medical students, among others. I think one thing that is really encouraging to see is that some countries or states have started to recognize how important it is for pharmacists to be able to recognize early warning signs of crisis and appropriately intervene in mental health related crises and ensure that people are safe when they are in that situation. So on this slide here, there's been some recent kind of media releases and that sort of thing in the UK, as well as in Washington state, which highlight this increasing recognition, and they've made suicide prevention training mandatory for pharmacists in some parts of the world. And hopefully that kind of minimum standard of mental health education continues to be recognized as integral for pharmacists in the community. I guess one area that we need more research is about the impact of mental health first aid training on actual behaviors, as well as patient outcomes. And a recent kind of review looked into this and found that we really do need more evidence in that area. Our team has been working on looking at how we can simulate different mental health first aid related scenarios in the classroom to allow students and pharmacists to practice their skills in safe learning environments. And in a sense, that allows us to observe and measure actual behaviors, but we really do need to find ways to evaluate this in real life settings. So hopefully that is the next step. So to summarize, I guess, I hope that the presentation today highlights how important pharmacists' roles are in supporting people experiencing mental health problems and crises and living with mental illnesses. And despite great advances in the evidence base, stigma and lack of training remain as key barriers in this area. So there is a need for clearly articulated roles for pharmacists, as well as remuneration, support, support through established referral pathways, as well as training. And however, I'd like to conclude by saying that having the recognition and support of our leading international organization, FIP, is such an important step towards defining, evaluating, and supporting pharmacists' roles in mental health care. Thank you very much for listening to our presentation.
Thank you very much, Claire and Sarira, for your brilliant presentation. If you have some questions to Dr. Sarira and Dr. Claire, please leave your questions in the Q&A box. We have some of them already answered, but if you have more, please leave in the Q&A. Our next speaker is Jeff Dong, that will present the Mental Health Care Handbook for Pharmacists. Jeff is a third-year pharmacy student at the UNC Wellsman School of Pharmacy. He graduated from the University of Maryland with a BS in biological science. With a strong interest in entering the pharmaceutical industry, he is working towards developing a great understanding of global pharmaceutical affairs and translational medical knowledge through his position in the research committee at ACMA. At the UNC, he is actively involved in IPHO, ISPOR, and GEO, where he served as the Fellowship Prep Series Manager, President-elect, and Secretary. Thank you very much, Jeff. Over to you.
Hi. Thank you so much for the introduction. So as mentioned, today we are excited to be publishing a new resource for pharmacists about mental health care and the roles pharmacists can play in their communities. So to take a step back and to frame our conversation today, why is this so important? Mental health affects more than 1 billion people worldwide, with 14.3 or 8 million of all deaths globally every single year, attributing to mental disorders. And this number has increased in recent years due to COVID-19, with the WHO estimating that there was a 25% increase in the prevalence of depression and anxiety in the first year of the pandemic. That's a 53.2 million more cases of depressive disorders and 76.2 million more anxiety disorder. And we see this more in lower middle income countries over upper middle or high income countries. And in these low and middle income countries, more than 75% of individuals with mental, neurological, and substance use disorders receive no treatment for their condition. And this is because of the lack of mental health care workers. All in all, this data really illustrates why this is a huge public health problem and why we need all hands on deck to reduce these numbers. And of course, pharmacists need to be part of these efforts. So in our handbook, it's divided into 13 sections, and I'll go into each of them in a little bit more in depth. There are 3 new sections that are not in this slide and are included in the final publication, and they are suicide prevention, maintaining therapeutic relationships, and referrals. So moving along to our first section, which is promotion of mental well-being and preventing illness. It focuses on the roles of pharmacists that pharmacists can play in promoting well-being and preventing addiction, substance use disorder, and overdose through naloxone and prescription monitoring. And we also dive deeper into social prescribing, where pharmacists refer individuals to programs within their communities that may be able to help them. On to our next section, which is identifying signs and symptoms of mental illness where pharmacists can play roles in screening patients for mental illness. In our responding to mental health crises, where pharmacists can partake in training in mental health first aid, where it empowers and equips individuals with the knowledge and skills and confidence needed to support those experiencing a mental health problem or crisis, such as being suicidal. Within the next 3 sections, which is not included in this slide, the first section is suicide prevention and medication-related means restriction for suicide risk mitigation. It involves where we discuss what is currently being implemented in countries such as the UK, Australia, or the US. With that, in the next section, establishing and maintaining a therapeutic relationship, it covers the importance of building a relationship of trust, mutual respect, open communication, cooperation, and shared decision-making around the therapeutic goals of the patient. And the next section, it's referral and interpersonal collaboration to support patient mental health. It focuses on the interpersonal collaborative care models. And now moving on to the next section, the 7th section of our handbook involves psychotropic medication optimization, where it covers many topics ranging from counseling, treatment outcomes, adherence, drug interactions, all the way to longitudinal care of the whole patient and ensuring optimal psychotropic pharmacotherapy. Now in section 8, we talk about the roles of transitional care, where we talk about signposting to mental health facilities and discharges and follow-ups. In measuring outcomes and metrics for mental health services, we look at the 6 domains of the quality of mental health care provided, which include safe, effective, patient-centered, timely, efficient, and equitable. In our 10th section, we focus on practice-based research on pharmacists' roles in mental health services, which includes, this chapter includes the requirements of effectively implementing a program with necessary collaboration and models, as well as tracking improvement of the program that pharmacists can implement. In our 11th section, we talk about supporting the mental health of pharmacy teams, where we explain the mental health resources that are available for pharmacy workforce, along with the ways to improve mental health within the pharmacy team. And in our next section, we talk about ethical consideration, where we talk about the 4 main ethical principles of non-maleficence, beneficence, autonomy, and justice. And moving on to our last section, where we talk about barriers and facilitators to providing mental health services. It focuses on the type of barriers that pharmacists may encounter when providing mental health services. And this chapter also introduces our concurrent publication of the Knowledge and Skills Guide to support further development. So what are the opportunities for pharmacists to be involved in? As one of the most trusted and accessible healthcare providers, pharmacists have a great opportunity to play a substantial role in providing mental health services. And I would like to note that these are not a complete list of that are explained in that are completely explained in the handbook. So pharmacists can really get involved throughout the continuum of care, from promoting mental well-being to identifying people who have not been previously diagnosed through screenings, to managing mental health services and helping patients with their treatment goals. and leveraging medication expertise to providing counseling services to help patients understand the medication they are taking and helping them optimize their treatments. With that all in mind, we developed this handbook around the idea that pharmacists can be involved in mental health care from awareness to treatment. And with this toolkit, we hope to encourage pharmacists to join global efforts to address rising rates of mental illness. There is an enormous potential to improve public health if these services are integrated into practice worldwide. As pharmacists can be involved in screening for mental illness, responding to crises, social prescribing, interpersonal team collaboration, medication optimization, and participating in transition of care services. Along with that, it's also important for pharmacists to consider their own mental health and the mental health of their pharmacy team, and to take steps to ensure they are receiving the necessary care and resources to support their mental health and well-being. Thank you so much, everyone, for listening.
Thank you very much, Jeff, for presenting this important tool for pharmacists worldwide. And I would especially like to thank Lauren Bloom from University of North Carolina, Wellsman School of Pharmacy for leading the authorship and coordinating of this handbook together with Jeff. I also want to thank all the authors and experts from the advisory group that collaborate on this publication. They are crucial to this tool. So I'd like to thank Dr. Amal Akur, Associate Professor of Pharmacotherapy, Department of Pharmacology and Therapeutics, College of Medicine and Health Science, United Arab Emirates, University, Jordan. Dr. Sarira Elden, Lecturer, School of Pharmacy, Faculty of Medicine and Health, the University of Sydney, Australia. Professor David Gardner, Professor from the Department of Psychiatry, the Louise University, Canada. Dr. Ailey Gorton, Senior Lecturer in Pharmacy Practice, University of Worcestershire, UK. Dr. Martina Head, expert in psychiatry pharmacy, member of the ESCP General Committee, the European Society of Clinical Pharmacy, German. Dr. Andrea Murphy, Associate Professor, Dan Louise University, Canada. Dr. David Odiambo, Pharmacist, Kenya. Dr. Claire O'Reilly, Senior Lecturer, School of Pharmacy, Faculty of Medicine and Health, the University of Sydney, Australia, and Dr. Metesh Suchke, sorry if I'm not spelling right, Professor of Clinical Pharmacy and Pharmacology, Mental Health, Clinical Pharmacist, European Society of Clinical Pharmacy, Slovenia. Thank you so much for your contributions. And now we move to our last speaker, Dalia. Dalia Bagis, that will present the Knowledge and Skills Reference Guide for Professional Development in Mental Health Care, a companion to the FIP Mental Health Care Handbook for Pharmacists. Dalia, Dr. Dalia Bagis is the FIP lead for provision and partnerships. Dalia comes from a background in pharmacy practice and academia. She is registered pharmacist in Australia and has a PhD in pharmacy education and training from the University of Sydney. Thank you very much, Dalia, and the floor is yours.
Thank you so much, Ines, for your moderation, and also thank you so much to our previous speakers for this enlightening presentation, which I thoroughly enjoyed it, and I'm sure as well that our listeners have really enjoyed it as well. It's my great pleasure to present to you the next FIP publication on mental health care, the Knowledge and Skills Reference Guide for Professional Development in Mental Health Care, a companion to the FIP Mental Health Care, the Handbook for Pharmacists that Jeff has kindly introduced you to. I've had the pleasure to develop this publication with support from Jeff, but also an amazing advisory group that Claire and Sarira have sat on, who have really overseen the content development of this publication, and have also been our two esteemed speakers for this webinar. Next slide, please. Apologies, the previous one, sorry. Let's go back to the previous one. Thanks, Ruben. Lovely. As you all have heard from Sarira and Claire, and supported by projects and research in the area, pharmacists can play an important role in mental health care. We've heard it over and over again today. As trusted healthcare professionals, pharmacists are ideally positioned to recognize symptoms and work with other healthcare colleagues to support patients with mental health illness. They can promote mental health and well-being among their patients to prevent individuals from developing mental illness as well. They can also leverage their accessibility, as Claire mentioned, to identify early warning signs and engage in conversation, provide opportunities for triage and referring patients on to seek further healthcare attention and support for those that are experiencing mental health illness, particularly. But we have also learned about some of the barriers to providing services related to pharmacists' lack of confidence, attitudes, and stigma that Sarira described. And this points out to the need to equip pharmacists with essential knowledge and skills in the care for patients with mental health problems and to combat stigma, which is prevalent in the healthcare setting and is not foreign to it. One of the ways to reduce stigma, to equip pharmacists with knowledge and skills in mental health and suicide prevention, to improve pharmacists' attitudes towards mental illness is education and training. It is recognized that pharmacists need to acquire new knowledge and skills specifically focused on evidence-based, patient-centered interventions to support people experiencing mental health problems or living with mental illness. These evidence-based roles and interventions have been described and emphasized in the newly launched Handbook for Pharmacists in Mental Health Care, which Jeff ran through the various sections of just before me. Next slide, please, Ruben. And here is a slide where I describe to you the development or the methodology behind the development of the Knowledge and Skills Reference Guide. The reference guide draws on pharmacist roles, some of the services and the interventions that our speakers have alluded to, but also have been highlighted in the handbook. But they also describe what has already been developed by FIP's previous publications since 2015 that culminated in the development of the 2022 Handbook to support pharmacists in practice to really advance care in the area of mental health. So in addition to conducting further research, the guide was also finally reviewed by the advisory group, which was made up of experts in the area of mental health education, training and research to really deliver to a global audience a comprehensive set of statements on knowledge and skills or associated skills required by pharmacists to fulfill a variety of roles related to mental health and supporting people living with mental illness. Next slide, please, Ruben. The statements in the Knowledge and Skills Guide are categorized by topic, but really importantly, they link to the 4 competency clusters, of the FIP Global Competency Framework, the GBCF, the 2020 version, which I can add the link to in the chat box. The 4 competency clusters are pharmaceutical public health, pharmaceutical care, organization and management, professional and personal development. So we recognize that a lot of the topics were really underpinned by the overarching competency clusters to really try and categorize and really provide a bit of a structure for the guide and a reference point to us all as we proceed with the professional development endeavors. And so the topic groups were further categorized to reflect specific topic areas to the topic of mental health. And you will see this as you explore the handbook, but I'll provide you with an example in a moment. On the next slide, I described to you how the reference guide is also organized. It is divided into two big comprehensive tables. The first one is the knowledge guide, which, as I've explained, is categorized by topic, but also underpinned by the competency clusters. The second part is another long table of associated skills that pharmacists could acquire or equip themselves with to deliver some of these services that have been highlighted in the knowledge guide and also in the handbook. This guide can be used as a self-learning tool by pharmacists themselves for professional development. They can also act as a supportive tool in the development of education and training courses in the area of mental health. So it could be also a useful resource to continuing professional development providers in course and program development. It's also useful for educators, whether in undergraduate, postgraduate, or in CPD and continuing education programs as well. To give you an idea, on the next slide, I provide you with just a snippet of the table, just as an example. On the slide, you see that the overarching competency cluster is public health. Under that, there is a broad category in relation to public health strategies and how pharmacists need to demonstrate knowledge and understanding of various aspects related to public health strategies. These include advocacy and promotion, and our previous speakers have highlighted the importance of this, particularly when it comes to roles related to screening, prevention, and referral systems. And the adjacent to that is a number of statements that could be referred to as we embark upon professional development activities in this particular area for people that either want to upskill, further equip, advance, improve, or have a special interest in the area to support ourselves, but also to support the patients and the communities that we serve. So, colleagues, on the next slide is the cover page of the Knowledge and Skills Guide with a QR code that I invite you to scan. We are delighted to launch the guide with you today, and I would welcome you to scan it, and I'll also add the link to it in the chat box for your convenience. And I just would like to say that, as our previous speakers have already alluded and described so eloquently, the evidence really suggests that there is a need to improve pharmacists' awareness of the importance of patient-centered care in mental health. And this really calls for the development of specific training programs that build the knowledge and skills of pharmacists in the context of mental health globally, but particularly in low to middle income countries as well. We really hope that this resource provides you and our global audience a guide, a mapping tool in pharmacy professional development journeys. I think the statements are meant to be prescriptive. They're not probably have not covered all aspects of providing different interventions by pharmacists in the area, but they provide a comprehensive and an adequate resource for us in our professional development journeys. And I would like to really hear your feedback about it if you are interested to learn more about the publication, but also if you're interested to know more about the Provision and Partnerships Programme at FIP, where we have a programme that awards the FIP seal to quality programmes in various areas. And if you're a listener that has an interest in this particular topic, please do email me for a chat about this. I would like to finally acknowledge and thank the advisory group that were instrumental in revising this document. And without them, we would not have achieved the quality that we at FIP always aim for. Dr. Sarira Elden from the University of Sydney and Dr. Claire O'Reilly, both of our speakers, but we also have Professor Matthew Stewart from the European Society of Clinical Pharmacy. Thank you so much to all of you, and thanks to the project team and Gonzo's leadership, Jeff, Lauren, the entire team, Ines and Ruben, for all your support, and congratulations on the achievements for these publications. Thanks a million. Thanks for listening.
Thank you so much, Dalia. Amazing publication and valuable for our membership, and thank you so much for your work. And now we'll move to our panel discussions and to our questions. We have some questions in the Q&A, some of them already answered, but we have some more questions. And the first question, I have lots of questions asking if the copy of the handbook and the companion will be available online, and the answer is yes. Both publications will be available today on FIP.org and also on the mental health microsite. And moving to the questions, I enjoy all the panelists to open your cameras. Thank you very much. And I start to ask maybe Claire or Sarira, do you think pharmacists are aware of the importance of mental health, of the patient's mental health, and also for their own mental health?
Thanks, Inez, for that one. Look, I think a couple of aspects to that question. I think in general, there's been a growing interest among pharmacists about their role in mental health care in recent years. I think we've really seen a vast increase in that, which is fantastic to see, because I see that pharmacists are recognising the need in their community among their patients. And then I think that the next aspect to that is making sure, as Sarira talked a lot about, around making sure that as pharmacists we are trained to recognise those signs and symptoms, so that we're recognising that there are mental health concerns, but also that we feel confident to raise those concerns and have a conversation about it. I think the confidence around those tricky conversations, it's sometimes not easy conversations to have, is really important. And then I think just on your last bit, and then I'm sure Sarira would like to add in as well, is that I think the point about pharmacists' own mental health is an important part that has been brought into these documents, because I think you would all agree that now more than ever has been a really critical time to support pharmacists' own mental health and wellbeing, being through COVID, being very burnt out, being on the front line through all of this, that we certainly worry about pharmacists' own mental health and wellbeing, and we need to make sure that we're recognising that in our colleagues, ourselves, and having the right kind of supports for that as well. Sarira may want to add more to that.
Yeah, 100% agree with everything Claire has just said. And I think, looking at the chat today, I think it's a big yes from all the great comments, feedback, and questions that show us that pharmacists are really engaged and interested in this area. And I think sometimes one of the biggest barriers in their different workplaces is time, in addition to, of course, training and the skills needed that Claire's already alluded to. Sometimes you're the only pharmacist on duty, and there's only so much you can get through. So I think having considering those barriers will be important in the next steps of research and evaluation in this area.
Thank you very much. And can you give some examples or some tips? How can we have a good mental health, like professionals? not only in the communities, in hospitals, but in every institutions, also in FIP. How can pharmacists could maintain a good mental health? Some tips. This question is not just for Claire or Sarira, also for Jeff and Delia to share.
I'm happy to chime in and talk about, one program which we've already talked about today, being mental health first aid training. And, mental health first aid training is not just something that is important for pharmacists, but here in Australia, we have different versions of the training, one of which is for workplaces. And it really goes into the importance of ensuring that the workplace is a safe space for people to take mental health sick days, for example, or feel comfortable enough to disclose that they are someone who takes an antidepressant or another type of psychotropic medicine. And I think having more people in the workplace kind of trained, and I guess the thing about training is that it also helps kind of in reducing stigma, in that, it's a group of people from the workplace coming together, sitting together for 5, 6, 7, however many hours to talk about mental health. And I think that signals to employees that this is something that the management or the leadership of that workplace is taking very seriously and committing to and investing time and money and energy into. So I think that's my little, I guess, tip on in that area.
I just want to add to that in some countries, and we did talk about this in one of our great webinars last year, is that there are some organisations in some countries which are focused on supporting pharmacists' own wellbeing. So I know in the UK and in Australia, there are support services for pharmacists which are often run by volunteers that are an independent place that you can call if you're really having a tough time to talk through these type of things. And a lot of these organisations also have some wonderful supports and strategies and suggestions and tips. And a lot of these have been referenced in the handbook. So I'd encourage you to have a bit of a read about that as well, and look at some tips that you can kind of share with your colleagues about some of that too.
I can just add in as well to what Sarira and Claire have already mentioned. And I think that it really is quite important for a lot of us in the workplace, managers and leaders, to recognize, firstly, the importance of maintaining improved mental health amongst workers, peers, colleagues in the workplace. And I think with the pandemic, and whilst we all work in different areas of practice, whether you work in community pharmacy, hospital, academia, or in an office with project management, or whatever it is that you're doing, I think it's really important to start with on the premise that there's a need to recognize the importance of mental health and well-being in the workplace. So whilst we're looking after others, we have to also look after ourselves, so that we can, it's like put the oxygen mask on first before you help others, metaphor. I can also share with you from my own personal experience that working in academia at the beginning of the pandemic, I also experienced some encounters with students that would, contact me or email me describing signs of mental health issues or problems, where at that time, I also didn't really know how to deal with that. And I took it upon myself to pursue a course in mental health first aid, to be able to know how to handle situations like this, so that I am available, even as an educator, as an academic, or even as a colleague. So I really would add my voice to the colleagues that, first of all, recognizing the importance of us raising awareness in the workplace, but also recognizing that on an individual level, what kind of skills and knowledge do you really need? And for me, it was, I'd like to start with a course on mental health first aid to see what that would entail. Thanks, Ines.
Thank you so much, Delia. Jeff, do you want to add something? Some tip for maintaining your well-being in the university? Very important for youth pharmacists and for students. How to maintain mental health during the exams? Some tip.
I know during exams, for students, I'm a third-year student. During my first year, we had exams every single week for about like a month or two straight. So it was really tough maintaining my mental health then. But I found that ways that I maintain my mental health was I have a dog, so like just going out to walks with my dog, that was really helpful. But I also have several hobbies like hiking. I love to hike to exercise, and that just gets my mind more clear after a study session or an exam.
Thank you so much for sharing. I think these tips are very important. They are very simple, but like walking the dog, breathe consciously, go walk into the nature. They are very do yoga or meditate. They are very simple tips, but I think they are very valuable for pharmacists and for everyone to maintain well-being, mental well-being. So moving to our next question, Surmano asking the Q&A how to optimize psychotropic medicines for mental health patients in community pharmacy, because psychotropic drugs is restricted drugs in my country. Please share information from other countries. I don't know if you can, if Sarira, Claire, do you have the answer?
I'm not sure of the situation in the country that's being referred to, so that it's a little bit tricky to answer, I guess. I guess in my perspective, I think we should be thinking about these medications like we would with any other medication. And I think that that's part of that destigmatizing of psychotropic medicines and people living with mental illness, in that they're taking a medication for a condition, for an illness. And I think, you know, we need to make sure that patients are informed, that they have the right medicine information to make those informed choices, and being aware about adverse effects, drug interactions, all these type of things. And I think we know that psychotropic medicines can often have some problematic aspects to them. We know they're not nice drugs sometimes to have to take, and that they might have lots of interactions and lots of side effects. And I think that's where the knowledge and skill guide really tries to articulate the types of information that as pharmacists we need to have, but also the skills to try and articulate that. So I think the guide would be a really great place to start with some of that. And it's obviously is very dependent on the country that you're in, I think.
Thank you very much. In reality, people living with mental health may have complex treatment regimens, and they benefit from supporting with strategy for improving adherence, right? Jeff, what roles do you think pharmacists can play in supporting the treatment optimization for people living with mental health? And in the Handbook, can you cite some examples of services would you find most valuable for improved adherence?
Sorry, could you say that one, the last word you said once more?
If you could give some examples that we have in the Handbook about services to improve adherence. How can we improve adherence for patients with mental illness? We have one question about digital technologies. Don't forget to take the medicines. Can you have
tools to improve adherence?
Tools to improve adherence
that have been mentioned in the Handbook. Have you got that handy, Jeff? If not, we can get back to Ines and the audience on that.
Yeah, and
sorry, yeah, we can get back to you on that. I need to pull that up real quick. My apologies.
Okay, no
worries.
problem, but you already have the link to the handbook in the chat box, and so you can go into this part and see examples of services to improve adherence. Moving forward, I have a question for you, Dalia. How can the knowledge and skills of pharmacists in mental health be improved?
And how can they be improved?
Yeah.
Okay.
The role, can you explain the role, for example, the university role?
Okay, so I think that education and training is a big part of improving our knowledge and skills in the area, and to be able to provide services in this particular area as well. But it does start early on, and I know that Claire and Syria will support me saying this, that it really can start from undergraduate education. And actually, I'm going to answer your question, Ines, but this really links quite nicely to a question that I wanted to mention to everyone from one of our guests on the call, Timen Sejan, who's asked, how do you think that pharmacy students who stayed 4 or 5 years, mostly in most countries, in university or college, can handle all of these opportunities? So I think this links to some of the projects and research that Claire and Syria are involved in, and perhaps they can comment on that as well. So Ines, going back to your question, yes, education and training in the area, raising awareness, working with others, I think is really important. So not only from a pharmaceutical expert point of view, we must really work in teams, in multidisciplinary teams. We really must adhere to our ethical standards when dealing with our patients living with mental illness, just like we do with any other patient or individual living with other diseases. So really adhering to our ethical way of working, working in teams, multidisciplinary, interprofessional, upskilling. These are really my reflections on how we can improve our knowledge and skills in the area. So just going back to that question, Claire and Syria, do you think that students can respond to these training opportunities at an undergraduate level? I think your research says yes, but I'll leave you to say to it.
Yeah, look, definitely. But I think we need not to be scared by all of the things that we've talked about and all of the roles, for example, that are in the handbook, that you might be expected to do all of these from day one. I think what we're trying to say is that certainly through education training, we need pharmacists, by the time they get out there, that they're comfortable to have these conversations. They recognize those early warning signs. They know they're confident in being able to ask the right questions, have a conversation, refer people onwards. And then as they progress through their career, there's opportunities to, do further postgraduate courses and gain further skills, and maybe focus more specifically on a mental health role. And I've seen some chat in there about the College of Mental Health Pharmacy in the UK, which is a great example of a specialised mental health organisation with further postgraduate training in the UK. And there's lots of opportunities to further that as you go down the track. I think, if I reflect that one of the reasons I got interested in mental health care in the first place was that I was a young pharmacist who was put in a community pharmacy setting where I had a number of situations where I had people who were acutely suicidal or acutely psychotic, and I had no idea what to do. I'd just come out of university. I knew all about the medications, but I had no idea about what to say or do when those situations were put in front of me. So I think, some of that can help in the early stages, and then it can build from there, and your roles, may take further different pathways from there. And as Ros has just pointed out, College of Mental Health Pharmacies International, based from the UK.
Thank you so much. We have another question from Beatrice. Apart from training sessions, is there a way to introduce mental health studies in undergraduate levels at various pharmacy schools in the early years in Africa, so we will be fully equipped to help others as it's done in developed countries? Want to answer to that question? Dalia, maybe?
No, so this goes back to some of the evidence that has come back from our researchers, where they have actually introduced courses to train pharmacy students in delivering mental health first aid. So the question really refers, Claire and Sarira, about what else can we teach undergraduate pharmacy students about mental health and people living with mental illness.
Thank you, Dalia. I have one last question because we don't have much more time, but Dalia, the Q&A guide, Q&S guide is like a training tool. Can you explain the difference?
So I wouldn't describe the knowledge and skills reference guides as a training tool. It is a guide with knowledge and skill topic areas that a pharmacist with interest in this topic is able to self-map to their professional development endeavors to really improve, advance their knowledge and skills. So it is not something that you pick up that will tell you how to get trained. It is something that you pick up to find out, what really do I need to know about supporting people living with mental illness. Okay, so it really is not a training tool. It is a guide. It is a mapping tool, if you like, to the different topics, different knowledge, different information that you really need to upskill in or equip yourself with. That's a really good question, Ines.
Thank you very much, Dalia. So we are almost at the end of our event. So I would like to my desk each of our panelists to provide a practical take-home message for pharmacists listening this webinar. Can we start with Claire?
Sure. Thanks, Inez. I guess I'm just really grateful for FIP in progressing this work because I think it's just really highlighting that as pharmacists, we have such a big contribution to make in terms of mental health care. And I think if we can just encourage pharmacists to feel more comfortable and confident in being able to have conversations with people about their mental health concerns, then I think that's a really great step forward.
Next, Jeff, can you provide just one take-home message?
Yeah. So I'm still a student, so I'm not a pharmacist yet. So I don't have experience within the field, but in my experience, it's listening, just having an open ear to people when they're speaking, and really try to understand them without judgment. So again, coming back to the point of using the correct language when speaking to another individual.
Thank you, Sarira.
Yeah, thank you, Inez, and thank you, FIP, for these great documents, which I'm sure will be a fantastic resource for pharmacists practicing in the community and hospital and other healthcare settings, but also for those who are designing curricula, either for undergraduate students or for continuing professional development, especially the knowledge and skills guide that Dalia alluded to. I guess for me, I think these kind of documents are great recognition on an international level of the roles pharmacists can play in this area and provide a really fantastic comprehensive overview. I would encourage all pharmacists, whenever they get the chance, to consider participating in research, because really that's the only way we can build the evidence base and make the case for support, remuneration, and establishing more kind of articulated pathways for pharmacists in this area. So if you get the opportunity, I hope you'll say yes.
Thanks, Sarira. Dalia,
Thank you so much. One last one. Thanks a million to the team. Thanks FIP for providing a platform for this amazing piece of work. I'd like to also let our audience know that actually we are also developing knowledge and skills guides for, as Ines mentioned early in the session, for those that didn't hear that, in all of the non-communicable diseases, the top five. So this is diabetes, mental health, cancer, cardiovascular, and respiratory diseases as well. In addition, we have a program at FIP that's called Transforming Conversations. Claire mentioned the word conversation, and I wanted to say this, that if you are someone, a pharmacist, a healthcare professional who is working in this area, mental health, well-being, have been at the front line and would like to perhaps share your experience, your research. I'm running a program called Transforming Conversations. It's a podcast program where we conduct interviews with practitioners and scientists to really relay and share some of their experiences in this particular area, actually. So you're very welcome to email me at dalia@fip.org if you're wanting to have a conversation and find out more about it. Thanks a million, Ines, for moderation.
Thank you so much. Before the close, FIP is excited to invite you to the FIP World Congress of Pharmacy. Please, Ruben. Yes, amazing. FIP World Congress of Pharmacy and Pharmaceutical Science in Seville, Spain. The Congress will take place from 18 to 22 September 2022 under the theme Pharmacy United in the Recovering of Healthcare. Registration and are already open. For more information, check our website, seville2022.fip.org. Please, Ruben. The recording of this episode will be made available on www.fip.org. Please provide your feedback to webinars@fip.org so FIP may contribute to improve their digital events offerings. Visit events.fip.org for all future events. One last thanks for your attendance, and to our brilliant speakers, many thanks. See you soon. Bye everyone. Have a nice day.